Thanks, Michael, and thank you also for your inspirational speech earlier. Firstly, I'd like to start by saying how pleased I am to have this opportunity to represent the people of WA in the Senate on the important issue of health. Our specific concerns are in relation to the mass medication of the healthy population with vaccines and fluoride. We are also very concerned about the attack on the natural health and our allied health professions in Australia that are founded on nutritional and holistic practices that should form the basis of good preventative health policy. It is also of great concern that the Australian mainstream media will not provide a balanced coverage of these health issues. The media will only present the issue of vaccines as anti-vaccination or a conspiracy theory. And journalists and health departments are not using objective science to promote vaccines to the public. They are using science provided by the vaccine industry medical paradigm. The majority of Australians want choice in the number of vaccines that they use. And this medical intervention has always been a choice in Australia for over 60 years. Yet, Scott Morrison and Christian Porter mandated the full vaccination schedule of 16 vaccines in coercive welfare, childcare and employment policies in 2016. This was at a time when there was no increased risk from these diseases in Australia. Why was this health policy introduced? Few adults in this room have used all of these 16 vaccines that are now mandated in children in order for parents, I've been told, to receive up to $30,000 per child per year. That's the maximum benefit that some parents are able to receive in welfare benefits and early childhood education enrolment. Is this policy about health or bribing people to use all the vaccines that have been developed? Most people in this room are considered unvaccinated under this policy. And you need to ask yourselves, how many vaccines are you prepared to use in your children? And do you know the ingredients of these vaccines that you are injecting into your infant? Will you be prepared to use 16 plus, there's more in the pipeline being developed, vaccines when the legislation is passed for adults? And when the No Jab, No Pay went through in 2015, they raised the age. That was a childhood policy. Age 7, they raised the age to 20. So now adults are included in these policies, and we now have an Australian immunisation register to record your vaccination status. It is also unscientific to recommend that a drug be mandated in a genetically diverse population, because it is known that many individuals will be seriously harmed from this policy due to genetic predisposition. This is playing Russian roulette with our children's lives and our own. Since my PhD was published, the government and industry medical activists, many without health qualifications, have used the mainstream and social media and the official channels for debate to misrepresent my thesis to the public as anti-vaccination and a conspiracy theory. This is preventing open debate of the scientific arguments that I presented and that are supported by national and international academics. My PhD was an investigation of the control of infectious diseases in Australia and the role that vaccines played in this control. The historical data shows that the most significant reduction in risk, that's deaths and illnesses, from infectious diseases occurred after public health infrastructure was implemented in all developed countries by 1950 and 60. These improvements in the environment, sanitation and hygiene and nutrition significantly reduced the deaths and illnesses to these diseases. The diseases still occurred, but they were non-serious in the majority of cases, and they produced long-term immunity in the people. This is where the term herd immunity arose. Mild and asymptomatic cases of infectious diseases after 1950 created herd immunity in the population. The Australian government stopped monitoring the incidence of measles and whooping cough from 1950 to the 80s because these non-serious cases were not a risk to the majority of children, and they were beneficial to community protection. That is herd immunity. Most of the vaccines that were mandated in 2016 by the Morrison government were not developed until 1990. And no vaccine has ever been used in any community with a 95% uptake to control any disease. You ask the government, they can't tell you any community that's used a vaccine with a 95% uptake rate. So there is no evidence for the claim that vaccines can create herd immunity. And government vaccine advisors are not required to provide that evidence before a vaccine is recommended on the government schedule. Yet the government is being allowed to promote vaccines to the public as everyone's responsibility to vaccinate, to protect the community, even though there is no evidence for this claim. In recent times, the Health Department has published every non-serious case of measles in the media as a public health emergency. This is regardless of the fact that the cases are non-serious and that measles is less virulent in developed countries. It's a self-limiting disease and beneficial to long-term community protection, unlike vaccines which provide short-term protection with boosters required throughout life. Vaccines, like all drugs, contain many chemicals, and they cannot be used in populations without causing serious harm to some people due to the genetic makeup. But the Australian government and media are suppressing the science, and they are not ensuring that every doctor, politician, and parent knows the ingredients of vaccines before they recommend them in government policy or to patients. My PhD thesis provided proof that the Australian government has not performed safety studies that use a true inert placebo in the unvaccinated group for an appropriate long-term period in the clinical trials for vaccines before they recommend them to the public. The pharmaceutical companies fund the majority of research that is used by governments, and they have used aluminium adjuvants and previously marketed vaccines as the placebos in the unvaccinated group in clinical trials. They are not inert placebos. Those substances are known to have serious side effects in the human body, including autoimmune diseases and neurological damage. These safety studies with inert placebos have never been done, and the Australian government should not be linking 16 vaccines to welfare payments, enrolment in early childhood education, and employment situations without this scientific evidence. We are swapping one disease for another without properly assessing the risk and benefits. Health is more than just the diseases caused by infectious agents, and the current mandatory vaccination policies are ignoring the chronic illnesses that have skyrocketed in children and adults in direct correlation to the increase in vaccine uptake and number of vaccines. Childhood cancer, type 1 diabetes, rheumatoid arthritis, autism, and other autoimmune and neurological disorders have increased 5 to 10-fold over the last 2 decades in the Australian population. Autism has increased exponentially. My PhD thesis provides evidence that the government has never investigated this direct dose-response relationship that has been observed for 2 decades. And instead of showing concern for human health, Governments continue to claim that the occurrence of these chronic illnesses after vaccination are simply a coincidence. Coincidence is not scientific evidence, and parents should not accept that answer. This is proof that the Australian government's coercive and mandatory vaccination policies are not based on scientific evidence. Quality of life is dependent upon being free from all diseases, not just the diseases caused by infectious agents. And the Australian government cannot claim these policies to be protective health policies when children's health has seriously declined since the vaccination program expanded in 1990. We have 2 decades of evidence showing that children's health has significantly declined as the number of vaccines increased in all countries. Governments have not provided evidence of the role that vaccines played in reducing infectious diseases. This could be done by publicising the number of cases that are vaccinated and unvaccinated. How many of the measles cases that you heard of in the media recently, did they tell you whether they were vaccinated children or unvaccinated children? Did they tell you whether they were serious cases or non-serious cases? This information would demonstrate the efficacy of vaccines, and my research shows that this data has never been presented to the public or to doctors or to the government. It is well documented that many outbreaks of measles, whooping cough, flu, chickenpox, and other infectious diseases are occurring in the vaccinated children, not the unvaccinated children. It's documented in my thesis. So until governments provide this evidence, there is no justification for coercive and discriminatory vaccination policies which will exclude children from childcare facilities. There is no other health issue where the risks of a medication would be dismissed or ignored as they are with vaccination. And yet this medication is for healthy people, not sick people. The majority of Australians want choice in all medical interventions with fully informed consent. But the mainstream Australian media will not present the position of choice in vaccination. For over a decade, journalists have presented vaccination with false balance in the media, ignoring the risks of vaccines and promoting anecdotal evidence of the benefits. This is not scientific evidence, and the clinical trials for vaccines do not use true inert placebos in controlled trials or fully assess the ingredients of vaccines in the developing infant. This is the information that the government and the media is not providing to the public about vaccines and fluoride. These government policies are breaching international human rights regarding informed consent for all medical interventions. But even though Australia has signed and ratified the key international treaties on human rights, they have never been implemented into Australian domestic laws. As a representative of the Involuntary Medication Objectors Party, I will push to have these treaties implemented and adopted in Australian law. Australia is the only Western democracy without a national charter of rights. And currently there is extreme anxiety in Australian families because of the misinformation being provided about vaccines in the Australian government's $1 million education campaigns. Through the curriculums, through the Australian mainstream media, this is controlling people's opinions on vaccines, this false balance. These campaigns are indoctrination, not education, because they are not using objective and balanced information to educate the public. It is observed that industry-funded science is influencing government policies, university research, and the mainstream media's presentation of health issues. This is resulting in medical tyranny, because medical freedom is not protected in the Australian Constitution or in Australian domestic laws. This underscores the importance of maintaining press freedom and protest rights if we are going to protect human rights in Australia. It is time to act now in Australia, as we have seen the autonomy of doctors and all other regulated health professionals reduced through the threat of deregistration for presenting the risks of vaccines. These are being described and labelled as anti-vaccination, but the risks of vaccines must be assessed to know if these vaccines are safe in the human body. Also, the attacks on natural medicine and the other allied health professionals are marginalising these practices. Health cannot be promoted without doctors having the autonomy to speak on health issues. The Involuntary Medication Objectors Party would like to give the community a voice on these health issues and human rights, and we will be standing up for our right to health choice and bodily integrity by supporting fully informed consent to all medications. Thank you.